Today's guest is Erika Vitale is the Director of Infection Control and Pandemic Planning at Windsor Regional Hospital. Welcome, Erika.
Hi, thanks.
Now, this is the first question I always ask. How are you and your family doing at this time?
Well, I've been quite busy at work, as you can imagine, but my family is doing well. They're at home in their own self-isolation, I guess you could say, and they've been very supportive of me.
Excellent. So I know you're always planning for difficult times. How are the plans going, and can you plan for a pandemic of this size?
Well, I don't know if we could have planned for this type of pandemic and the way people would react to it and the size of it. I took over this role in January, and lo and behold, then we announced a pandemic. So there wasn't a lot of time to do groundwork, planning ahead of time. But I have to say that the team really did come together. Within the first couple of weeks of February, we had all of our plans in place, and then we've been just regularly updating them as new guidance might come from the ministry. So on a daily basis, we're reviewing any new documents or anything that might come that we might have to change part of our plan for.
How are you doing with supplies? I know that there's been a lot on social media for some of the companies to provide supplies or any local businesses. How is the supply now, and where are we going with that?
So our supply is looking more promising than it did a few weeks ago. We've been instructing staff to continue to extend the use of some of their personal protective equipment. So for example, with respect to respirators or a mask with face protection, we're asking them, once you put that on, to keep it on as long as you can until it's wet, contaminated, damaged, or it's just difficult for you to breathe and you need to have a break. So because they're extending the use of it as opposed to using it for a one-time use and then getting a new one, we've noticed our supplies have been more stable. So we have a good 2-week supply. We also have individuals sitting on provincial committees with respect to regional personal protective equipment allocation. So that's been very helpful. So these includes people from our materials management side of things as well. So they know what type of materials are getting in and what our regular usage is, and then how do we allocate those to the various facilities that are in need. So it's a good committee, and it's good communication and working together just to make sure that everyone has the supplies they need when they need them.
Yeah. Is there a line of communication between the hospital, the regional area, and actual provincial or federally?
Yes, so there are various what they're calling tables or groups of individuals or specialists. So for example, there's an IPAC table or infection prevention and control table. And that's our former LIN area. So this would include representation from Blue Water, Chatham-Kent, Leamington, and then of course the hospitals in Windsor. So we meet regularly and we discuss different items that might come up. Just a recent example is like, how are we going to manage employee exposures? And then we sit down together, write a protocol for that, and then we all adapt that within the region.
How is the testing going? I know I believe it's at the Olette campus. Are we communicating enough to people to ensure that they have symptoms before they come in, so as not to waste anyone's time, or to ensure that they do have symptoms?
Yeah, well, it is the symptoms that we're looking for is somebody with a fever, cough, or shortness of breath. Those are the individuals that will get tested. If you're asymptomatic, the test is actually not very useful. It could give you a false sense of security and actually be a false negative, because then you might get sick a few days later, and then that's when you really need to be tested, right? So when you're actually sick with the symptoms is when the viral load will be the highest and best detected by the test. So that's why we're focusing only on patients that are symptomatic for testing. We do still have people coming that are asymptomatic, and I think it's maybe out of some anxiety or some worries that they have that they were perhaps exposed to someone. But the best advice for those people is to self-monitor for those symptoms, so fever, cough, and shortness of breath. And if you start to develop those and you've had some type of exposure, then that's when you should be assessed at the assessment center. And I should point out also that it is open 9 to 4 daily. I think we had some people show up today at 7 a.m. Because I think they were misdirected potentially, but we are open 9 to 4 for testing.
9 to 4, Monday through Friday?
That's right. Okay. No, sorry, 7 days a week.
7 days a week, okay. Yeah. 9 to 4, 7 days a week. Important information for them. I know that last night, I think there was a press release put out about restrictions for visitors. Can you update us on that?
Yeah, so the biggest update there is we are excluding visitors from our intensive care unit for a couple reasons. We have very vulnerable population there, and we also have a lot of sick patients who are confirmed as having COVID-19. So we want to reduce the potential for exposure of our patients as well as any visitor that might be coming into the hospital. So we're restricting visitors in the intensive care unit.
Okay. And tell me, how is the morale of the staff?
Well, I think that all the staff do have their morale's good overall. They're prepared for this. They are used to using this type of personal protective equipment every day, so they should feel confident in using it and that it's protecting them. I do think there are some staff members that have some anxiety about it because, of course, you're coming to work in an environment where you know you could potentially be exposed to someone, and there's probably some anxiety about going home and bringing it to their loved ones at home. So there's that concern, right? Because we know it's out in the community, and we've heard stories as well of some of the healthcare workers, even from Michigan, getting quite ill. So there is a little bit of anxiety, but they should feel very confident with what they're doing and the personal protective equipment they have, because they're used to using this every day. Like, we use the same type of personal protective equipment all through flu season every year. So I think they just have to, take a step back and think about, okay, I know how to use this stuff. I know it protects me, and kind of move forward with that. But there's definitely some anxiety amongst some individuals.
Yeah, I would imagine anxiety, a bit of stress. We've got stress in the community about it. Last week we talked with Kim Willis from Canadian Mental Health Association. I would imagine, at the hospital it might be even increased. But like you said, this is what they do for a living. They know what's going on.
That's right.
Yeah. And I think the other thing is, hopefully the community, I think, has been outward in social media and people with signs. I saw one recently on my street. We love you, Mommy. Thanks for doing what you do. That has to help to reinforce all the healthcare workers and first responders through this difficult time.
Yeah, well, it certainly helps for me. I get a text every couple days or a couple a day just saying, thanks, Erika, for everything you do. And definitely when you reach out like that, it makes you feel more appreciated, and people realize, lets you realize that people know what you're doing and how important the work is. So.
Well, thanks for your time, Erika. Really appreciate it. Please thank all the staff at Windsor Regional Hospital. We know they're doing a tremendous job. I have a wife that works there, so we're kind of staying away from each other and trying to make sure that she's okay going there, and I'm here hopefully getting out the word to the community. So thanks again. Stay well and stay safe.
Okay, thank you.
That was Erika Vitale, Director of Infection Control and Pandemic Planning at Windsor Regional Hospital.